Hi everybody, it's May. It's almost summer. Super exciting. I'm in the Southwest, so we kind of make a big deal out of tomorrow. It's Cinco de Mayo. I don't know if even Mexico makes a big deal out of it. I've heard that they don't. I know it's a little noisy in here. I'm in the middle of doing a lot of things at once, and I am working today. But I wanted to say really quick, if you're having issues with brain fog, I know most women over 50, when they come to me, they say, they're having issues with their memory. They walk in a room, forget why they were there, where they put their keys. They can't remember the names of their certain authors or movies that is their favorite. So what I'm doing, and I'm not recommending you do it, I'm just saying you could start reading about this or talk to your practitioner about it. But let's talk about the easy things first. I am a fan of coffee, and it does stimulate my mind. Yeah, I know caffeine can cause palpitations. I'm careful. I don't drink coffee like I used to, and I cut way down on the amount of coffee versus water I put in my cup because I find that my heart rate does kind of take a hit if I drink really strong coffee. I can't do espresso anymore. So for me, I do coffee in the morning and avoid sugar. I'm so excited about the summer because that's when I really hit the no sugar hard, working out again hard, and just taking more time to take care of me versus everybody else, like family, patients, everyone else, friends. So avoiding sugar is huge. And then we've talked about omega-3 fatty acids, cooking with olive oil, avoiding seed oils, stuff like that. I am looking into nattokinase and serrapeptase. Nattokinase in studies has been shown to reduce the fibrous material in scar tissue, the tangles, the hard pieces you find in scar tissue. It's not exactly a blood thinner, but because it dissolves fibrin, if you're on a blood thinner or you have something healing, in my opinion, say you had your hip done and you have a new hip joint, that's not the time to be taking nattokinase, right? Because you do want some scar tissue to form to help heal and secure that joint. But for someone that hasn't had any recent surgery and not on blood thinners, and I'm not even I'll take a baby aspirin for prevention. I don't take it every day. Me personally, depending on my patients, if they have heart disease, high blood pressure, yes, I have them on it once a day. For myself, I'll do it once a week, maybe twice a week, just for prevention. And when your blood is a little thinner, it can get to all the parts easier, your eyes, your brain, and everything. If you're bruising, you're taking too much, but that's just what I do. And then again, it's patient dependent on how much I would recommend for them. And plus aspirin, it can cause polyps in the nose, bleeding gums. So you have to be careful with that. But nattokinase for, breaking down some fibrin and scar tissues. And I kind of think about, what does fibrin do in the body? Well, when you think about platelets clustering together and causing a blood clot, fibrin is involved in that process as well. It's the healing mechanism of the body to start healing a wound or an area inside or outside that's had trauma. So I'm thinking about nattokinase and doing a green superfood that has everything in it. Just as a great antioxidant, because if you haven't had your heavy metals tested, who knows? I was speaking to someone recently who had elevated levels of mercury and aluminum in their lab work, and we really couldn't find out where the aluminum is coming from. We were maybe discussing, is it from aluminum containing deodorant? But we don't know. I have no idea. But, it's not the worst thing in the world just to try deodorant that doesn't have aluminum in it, just doing the deodorant without the antiperspirant. And then as far as mercury goes, it's really prevalent in wild salmon, seafood. I happen to love seafood, but I try not to eat it all the time because I am concerned about mercury levels. Unfortunately, our planet is pretty polluted, and even in wild-caught salmon, there is a lot of mercury. Tuna, of course, is so great when I'm doing weight loss. I am going to do tuna this summer, but I haven't done it through fall, winter, spring, because I kind of reserve it for summer when I'm hitting weight loss harder. And to me, it's kind of decreasing my mercury. So why am I talking about heavy metals like mercury and aluminum? Because of brain fog, dementia, issues like that. So, and absolutely no sushi. I am not a fan of sushi. One, the mercury content, and we know how poisonous that is for the brain. But also, I read a statistic. I know it was greater than 30% of people that regularly eat sushi have parasites. And yeah, so I don't eat sushi. But, you know, I get it. If you love sushi, you do you. But I personally do not eat sushi. I'm trying to get as healthy of a brain as I can get. And then, of course, hormones. I'm not going to really go a deep dive into that, but a lot of new research has shown out that if you get a woman over 50, if she's menopausal on estradiol and she has a family history of dementia or Alzheimer's, it may protect her brain for that much longer and may, I want to say the statistic was it may reduce the risk of dementia in half. So lots of new research on hormones coming out. So that's food for thought. I do kind of like the herbs and oils that support hormone balance and health. I think in women, I love evening primrose oil. That's an anti-inflammatory. Again, that's great for the brain too. And it's a gamma-linoleic acid, really healthy. And the other one would be an herbal blend that has, you know, black cohosh, red raspberry, rhodiola, vitex. I know I'm forgetting some, but not all people can take those herbs. It can interfere with certain medications. I'm just throwing out some that I personally like. So that's just a little blurb on brain health. You know, I'm not a huge fan of certain medications that reduce cholesterol because we do need some cholesterol to constantly repair and replace the phospholipid bilayer that the brain cells are made up in. So I'm really kind of careful about that. So what could you do instead? You know, getting enough fiber, trying to be active every day, whether it's walking, cleaning your house. That's a lot of activity. Gardening is a lot of activity. All that running around the yard and sweeping and shoveling and raking. That's hard work. And then of course, just going to the gym, right? And then B vitamins like niacin and all that. But I get it. Some people need to be on those medications because it's that or they're really at risk for having a heart attack. But for some of my patients that their blood pressure is normal, they really don't have a cardiovascular risk going on, I'm really, really conservative with those type of medications because brain health, right? But, you know, in those medications, for example, if someone's on a statin, it's really crucial that they take CoQ10 and a good multivitamin with that because those tend to interfere with nutrients like that. So those were just some simple things. I didn't want to do a deep dive into like all the literature. Maybe I'll do that on the next video, but just some things to think about. I know I've talked about all this stuff before, but that's just a refresher course as we head into summer because it's going to be like, again, all about getting us to our best health possible this summer because now I'm going to have time to make videos again. Hopefully this is the first of many now for the summer series. And if you're doing something for your brain health, please post below. I would love to hear it. And yeah, I think that's it for today. See you on the next one.